Hi, this is Dr. Jones from Impact Orthopedics. One of the things we've seen several just in the last couple of weeks, primarily because of football season this fall, are shoulder dislocations. So we'll talk for a minute or two about shoulder dislocations. The shoulder is a golf ball that sits on a golf tee, and what adds stability to the shoulder is a labrum, which surrounds the golf tee, and also some very important ligament structures that surround the golf ball and attach to the perimeter of the golf tee. Most commonly we see an anterior dislocation, or the shoulder dislocates out the front of the shoulder. Rarely do we see a posterior dislocation, but the most common is the anterior dislocation. And in order for the shoulder, for the ball to come off the tee, move out in the front, and then dislocate or stay locked in front, something has to give, and usually it's the labrum and the structures that attach to the perimeter of the golf tee. Once that shoulder is reduced or put back in place, either naturally or on the field by the trainer, and then sometimes in an emergency room with some IV sedation, then the shoulder, the pain goes away or it subsides greatly. And then the options are several. One is non-operative treatment and letting the shoulder and the tissues heal back. And the other is an operative treatment. And generally speaking, in someone that's 15, 18, 20 years of age, if there's a traumatic dislocation, unless it's fixed operatively, then there's a 70 to 80% chance that shoulder will dislocate again because those major stabilizing structures have been torn off the front of the golf tee. And when surgery is performed, then that risk decreases down into the 5 to 10% range typically. And in surgery, what one does is pull back this torn off labrum and tissues, and tacks or small anchors are placed in the front of the golf tee from like the 3 o'clock to the 6 o'clock position in order to reattach those stabilizing structures. And then 4 to 6 months of physical therapy follow that in order for the shoulder to return to normal activities. So I hope this has provided some insight into shoulder dislocations. Please stay tuned for some more videos. Thank you.